thanks for tuning in to Shannon and Veronica Know Everything. Today we're going to be going over urinary incontinence. So this can occur in men and women. We're going to be focusing mostly on women because most of incontinence studies are done on women. So there's a couple different kinds we're going to go through. The first one is stress incontinence. So stress incontinence is very common in women after vaginal deliveries, sometimes the first delivery or sometimes multiple deliveries. Pretty much women just get a very weak pelvic floor after having their kids. So signs and symptoms is there's going to be a little bit of leakage when they're jumping, laughing, coughing, anything like that. So women will have to start kind of using pads and stuff. So treatment is going to be pelvic physical therapy. That's pretty much first line. You go to the physical therapist, they can help you retrain the pelvic floor muscles to be stronger, and then also Kegel exercises. Another interesting treatment is Cymbalta duloxetine. That's kind of newer, so that's just something to keep in mind. We'll probably have more data in a couple years on that. The second type is going to be overactive bladder, also known as urge incontinence. So this is the kind where people are going to be going to the bathroom a lot. So I like to think of this one as just going to the bathroom constantly. If your patient says they go into like their restaurants, any store, they know exactly where all the bathrooms are. They're going every hour, every half hour. Overactive bladder. One thing to know is this wasn't in our lecture, but it's good to know that there can be wet and dry. So a lot of the times people are going to the bathroom way too much, but they never leak. Other times people are going to the bathroom way too much and they can't make it. So sometimes they do have episodes of leakage. So that's more the urge portion of it. So going to the bathroom too often, plus or minus leakage. Treatment can be a surgical sling or medications. Medications are going to be anticholinergics. So oxybutynin is an example. Side effects of anticholinergics, they dry you out. So it makes sense if you're going to the bathroom too often, a med that'll dry you out. It's going to help you not go as much. So with anticholinergics, we hear the dry as a bat, crazy as a something, mad as a hatter, that's it. So mostly just like the really dry mouth, dry eyes, and it's like cognitive impairment. Our third category is mixed stress and overactive bladder incontinence. So the one thing to note with this, you're going to have symptoms of both, but you're going to want to treat the overactive bladder first. Why that is, I'm not totally sure, but it kind of makes sense that if you reduce the number of times patients going to the bathroom, then they won't have to leak as much. So they won't have as much of stress if they're like jumping or moving around. Our next category is neurogenic bladder. Essentially, this is just an absent neural response. I believe a lot of people inpatient have this after like getting catheter or anything, because a lot of the times we have to do bladder scans and patients just don't realize that I have a bunch of urinary retention. So it's kind of like somewhere in the nervous system there's a breakdown in the pathway where you just have to end up straight cathing your patients because they're just retaining a lot of urine and really not getting it all out. The next we have is overflow urine. Overflow urine is unique in that you empty the entire bladder, no warning. So I could just be walking down the road, no trigger, no feeling of having to run to the bathroom, and you just empty your bladder. So to review, we went over urinary incontinence. That kind of the most important one to remember is overactive bladder with the meds, anticholinergic, oxybutynin, and all the side effects of those. Thanks, Eva.